I am Lacey Nobles with the City of Lubbock. We will start our press conference in just a few seconds. Good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. We will have updates today from our panelists, Director of Public Health, Catherine Wells, Dr. Ron Cook, Local Health Authority, and Lubbock Mayor Dan Pope. So let's kick things off with Catherine Wells.
Good morning, everyone. I want to update you on our current number of COVID-19 cases in Lubbock and also talk a little bit about some of the trends we're seeing in the health department as we complete these case investigations. The health department is reporting 5,752 cases of COVID-19 as of yesterday evening, August 4th. Of these, 3,831 are recovered. We continue to have active cases at 1,841, and unfortunately, we've now seen 79 Lubbock County residents die from COVID-19 since the beginning of this epidemic. The number of cases reported to us has really leveled off over the last few weeks, and this can be attributed to wearing masks and continued social distancing. As we move into the fall and look at returning to school and many people returning to work, we need to make sure that we continue wearing masks and social distancing. It's very important. These are the two main things that are going to help us slow the spread of COVID. We also need the public to stay home when they feel like they have COVID symptoms or are in the process of getting tested. Over the last few weeks, we've identified multiple people who have gone for testing, and then instead of going home after while they wait for their test results, we've actually seen them go back to work and start going back to their normal activity. Then a couple days later, we find out that they're positive. This can be a concern because these individuals during this time, it's probably the time that they're most infectious and they're most likely to be spreading virus to other individuals. So if you think you need to get tested or in the process of getting tested, it is very important that you stay home and isolate while the physician or the testing facility is making that determination of whether or not you have COVID. It's key to do this so that we don't continue to see the spread among others, especially your coworkers or your family. The health department's here. We continue to be open 7 days a week. Please reach out to us if you have any questions. We're here to talk to the public. We're here to talk to medical providers, schools, anybody out in the community that has questions. So please call. Our phone number is 806-775-2933. And I'm going to go ahead and turn it over to Dr. Cook. Thank you.
Thank you, Catherine. Let me just reiterate, that makes us feel good that our numbers are decreasing. Our number of positive tests are decreasing. That's due to all of your efforts. That's the facial covering and the social distancing and lots of disinfection and cleaning that you're doing. Those things are working. Now, we still see that our hospitalizations are still pretty high, and our death rate compared to a few weeks ago is still pretty high. And hospitalizations and deaths always lag behind the number of infections. And so as our infection rate goes down, our hospitalization, as those people get better, will go down. And then as those really sick people who may pass away from this, those numbers will continue to go down. So it's like a train. As the train heads downhill or a roller coaster heads downhill, it's gonna get better. I'm excited about that. That makes us feel good that everybody in the community is doing their part. Thank you for doing those things. Let me just say that our access to city testing has certainly increased, and I think the mayor's going to go over that a little bit. And if you have any questions about that, you can see that information on our city health department's website. And reiterate the fact that if you've been tested, please stay home, stay away from people until your test result comes in. Because like Catherine said, there's a reason why you got tested, and so please stay home. We don't want you spreading the virus to other people while you wait for that test. School is around the corner. I think some people are starting next week. So let me reiterate here that schools have plans for you, and our children need to be back in school, and we have developed all kinds of plans for the students and the learners' safety. I know that they're worked on social distancing and distance learning and setting up safe environments for your children to be engaged in learning. You know, we all need social gatherings, and we need that interaction, and our students especially need their teachers, and our teachers need their students, and they want each other to learn. So I know it's a little scary, uh, and we're all a bit nervous about it, and I do expect perhaps that our numbers may increase, but if we do our part and continue to social distance and wear our facial coverings in schools, we'll be able to slow this virus. So I have all the confidence in the world that we can do this. My biggest concern is that when those children return home from school, that they may be returning to individuals that are at high risk to catch this disease and may not do well, or are vulnerable patient populations. So there's not an easy way to help prevent that, other than my recommendation here is as soon as your child gets home from school, wash them up really well, scrub them down, perhaps change clothes, and so that they're not carrying those infected garments around with them. The other thing to do, and I know this is even harder, is to socially distance from those individuals that may be at high risk that live in the same household. I know that it's hard, but let's give it a try and make sure that we don't get those individuals sick. The other thing I want to visit with you about, many of you have recovered from COVID, and some of you may have what we call post-COVID syndrome. Now, post-COVID syndrome are these lingering symptoms that continue just to go on and on and on after you've gotten 70% better, 80% better. And this is a new virus, so it's very new to us to see this post-COVID syndrome. But the most common symptoms that we see in this post-COVID syndrome are continued cough, continued fatigue, continued shortness of breath, and the inability to smell or to taste. Even there's this brain fog that some people develop as a result of COVID, and that's what we call some encephalitis. So that post-COVID fog eventually does clear up. We have no indication that it's going to be permanent. How do we get better? You get better by trying to get back to your normal routine. Go one step further each day. Keep moving. Don't sit still. Make sure you eat healthy. Get out and get some sunshine. And again, we have no indication that this is going to be anything permanent. Let me share with you some really good news that's not related to COVID. So I read journals and scour the internet and journals for all kinds of new information regarding COVID. Well, this is not COVID related, but I came across it and it's so good I had to share it with you. The European Journal of Preventive Cardiology says that if you consume chocolate more than 1 time a week or more than 3.5 times in a month, that it is associated with a decreased risk of cardiovascular disease. And that's the European Journal of Preventive Cardiology. Now, when I say that, you must be very careful. It's not pounds of chocolate in a serving. It's probably one little square off that candy bar. And that's 1 time a week, okay? Probably dark chocolate is better than milk chocolate, is better than white chocolate. And so just be careful. Everything in moderation. A little chocolate is not going to hurt. And now we have evidence that it does good things for your heart. So eat more chocolate. That's all that I have. That's my good news for today. Let me hand this off to Mayor Pope.
Pardon me while I continue to write that note. I might write myself a doctor's note about chocolate here. So thank you there, Dr. Cook.
My pleasure, anytime.
Yeah, we appreciate that. Good morning, everyone. It's good to be with you today. It's a great day in Lubbock, Texas. I'm so thankful for all of you. I want to share 4 data slides, so please allow me to share my screen. Okay, here we go. So first, our positivity rate, good trend here. The last week, we've been in the 9 to 12% positivity rate range. You remember that a month ago, we were 16, 17% over a 14-day average. If you go back to day 0 or day 1 on this, back to March, we're about 8%. But we've got this going the right direction. I thought you'd like to see this. Hospitalized patients. So if you go back 3.5 weeks, we've sort of been this range from 95, I think, on the low to about 117 on the high for the most part, between 100 and 110. Roughly 50-50 split between those that are in the ICU and on patient floors, probably leaning a little bit towards patient floors. The message, I think, is that our hospitals are comfortable at this range and are still accepting patients, and we're so very thankful for that. This is a school age kids slide. So cases age 6 to 17, we've had 453 of those since the very beginning, and 302 of those have recovered. So we've got 151 of those that are active. And then finally, just our case count by age group over the last 14 days is something you're used to seeing. The vast majority of these cases are between 20 and 59. You remember that we had a real big spike in the 20 to 29 range. We've seen that move up a little bit age-wise, but this is where our positive cases are coming from. Okay. I want to echo Catherine's comments a little bit earlier about the families that have experienced the loss of loved ones, and those of you that have lost jobs and have businesses that have either closed or are not even open. We feel for you. You remain in our thoughts and our prayers. I want to say thank you also. I do believe that West Texas common sense and willingness to adapt is working, that covering our faces, hanging out in the same groups, trying to keep our physical distance, those things do work. We know they work. So thank you. Thank you so much for taking this seriously. We have good news around testing. Walgreens will open their test location at 6th Street and Avenue Q in North Overton, just by the Walmart there. They will open on Friday of this week. That testing location will operate 7 days a week. You need to go online and make a reservation, and there'll be press coming out about that today, but that's good news. So you add that testing location to Rogers Park, which is where the city large testing location is. So Rogers Park is in the 3200 block of Auburn. That's 2 blocks east of Indiana, just east of the Rawls Golf Course. So north of 4th Street, east of Indiana. 5 days a week, completely free. Also, this week we shifted the testing in on the eastern part of our community from Patterson Library, which will return to a library next weekend. We're getting it ready to go. That is shifted to the Combest Health Clinic. Combest shares property there with Harwell Elementary, and that also is a free testing location. Go online to get more information about that. I think most importantly, that is that Texas Tech and Lubbock ISD are doing testing. Lubbock ISD is testing at their high schools. Texas Tech is testing right out just south of 4th Street in the museum parking lot. We're seeing quite a bit of new testing going on. Now that's good, because we want to locate people that are sick, isolate them, they'll recover, they can come back to life, come back to work, go back to school. That very well could portend an increase in our total cases. But as long as we handle those the right way, quarantine, do it the right way, allow for recovery, that's a positive. We want to know where people that are sick are. So thanks to those of you that have been tested. And if you have any reason to believe you've been exposed or have any symptoms, please get tested. Finally, let's talk about schools. I'm solidly on the side of the argument that says reopening schools is good for kids. Now, I know that that's where if you read the national organizations of pediatricians, that's where they land. I think in Lubbock County, our big school districts, at least 7 out of 10 of our parents have said they want to send their kids back to school live. I think that's good. I think it's good for the social and mental development of our kids. However, there is an environment, or there is an accommodation that's been made for kids who need to study online and go to school online, whether it's a parent that doesn't feel good about sending their kid back to school, or they may have an environment at home where they live with vulnerable populations, grandparents or other family members. That online school option is available. I think it will be effective, and I'm proud of the way our districts have responded. You need to know that Catherine Wells and her team are very active with our school districts, and they've helped them build protocols, and we will be involved with what will be likely situations where we'll have positive cases, and the schools will quickly adapt to that, and we'll have to pivot, and we'll have to be flexible. It's not going to be like it used to be, but we're ready to go forward, and we're ready to get our kids back to school. Remember that the kids going back to school allows parents to work. I was talking to a large employer last week of a locally owned business, and he reminded me in no uncertain terms, he said 70% of our employees, they employ about 400 people, 70% of our employees are from families where both parents work. And schools being open not only allows their kids to learn, but it allows mom and dad to work and pay rent or pay mortgage, put food on the table, buy clothes, do the things that are so important to us. So we can reopen schools safely. We're going to have to be smart about it. But I'm supportive of those efforts, whether it be K-12 or higher education. We can safely and responsibly, sensibly return to a life that we recognize. So I'm thankful for each of you. I look forward to being with you again next week. Lacey, back to you.
Thank you, Mayor Pope, and to all of our panelists. Now we'll open it up for media questions. Today's media order is KMAC, KCBD, Fox 34, El Editor, KLBK, The Daily Toreador, Latino Lubbock, and the Avalanche Journal. So we'll start our questioning with Matthew Stell from KMAC.
Thanks so much, Lacey. I've got a pretty extensive question. I'm going to give some background on it. And this question is mainly for Catherine Wells. Catherine, we had a viewer call us in this week. She says that she had brunch with one of her friends who works at a local nursing home. Turns out a few days later, after that brunch, that nursing home was on the list of exposure locations where there was a lot of cases. So the friend, knowing that she had just had brunch with that friend that worked at the nursing home, went and got tested at Hodges Elementary on July 17th. She didn't get a call from the Lubbock Health Department. According to her, she did not get a call from the health department until the 31st of July, 2 weeks later. And then she said when she got that call, when she spoke with those contact tracers or whoever it was from the health department, she said she didn't really, to her, they didn't really ask the right questions. She told the person on the phone that she had just went and played tennis. They did not ask where the woman had played tennis at. And she also told them that she had a 2-year-old daughter, and that she said the contact tracer did not ask where that daughter was in school, if that daughter was in daycare, anything like that. But most importantly, she's still concerned that she didn't get a call from the health department for 2 weeks. And she had already been tested, and she tested positive. But she's isolated. She isolated for 2 weeks. She's good. She's recovered very well. So my first question is this. Is that something that folks should expect, a 2-week turnaround to receive a call from the health department? Or should a person go ahead and call the health department themselves once they believe they've been exposed?
Kind of the couple different answers there. That's a lot.
That's all right.
It shouldn't expect 2 weeks to get a return from the health department. When we were being hit with 180, 200 cases a day, we did end up with a backlog. That backlog's since been taken care of, and we're currently calling people within 2 days of the test result being reported to the health department. There are delays or time between when they actually test to when we get that information at the health department, but right now we're working on calling people within 2 days. If they have not heard from us, I encourage them to call us, 775-2933. If she has concerns about what happened with that contact tracer, please have her reach out to me so I can discuss the specifics of that case.
Okay.
Catherine, isn't it also correct that the individual that's being tested is going to be notified directly prior to hearing from the health department? Is that correct or not?
Correct. So individuals that test through Rogers Park or any of the facilities being run by the Texas Department of Emergency Management will receive an email from that testing facility that they are indeed positive.
Okay.
And then we should be a second call checking on them.
That's correct. She said she got that email on Sunday, 2 days later, from when she tested positive. She did get that email, but from the health department, she hadn't heard back. But thank you so much, Catherine.
All right. Thank you.
Thanks, Matt. You're muted, Lacey.
Sorry. Now we have Karen McKay with KCBD.
Good morning.
Morning.
First question is, we have had a lot of COVID deaths recently. Do they include someone who died while they had COVID-19 or because they had COVID-19?
Karen, why don't you try that again? You were garbled in you said, we heard you say COVID deaths, but that's about it.
I'm sorry. Can you hear me? We've had a lot of COVID deaths recently. Do they include someone who died while they had COVID-19 or because they had COVID-19?
Catherine, you want to talk about that? I know we talked a bit about that last week.
Yes. So with the deaths, we're looking at whether or not COVID was a contributing factor of that individual's death. And that's how those are getting reported. We're also getting more feeds on actual death certificate data to see what the physician said the cause of death was. And if Dr. Cook wants to elaborate a little bit.
Yeah. Thanks, Karen. That's a good question. So the death certificate that's filled out on the Bureau of Vital Statistics in Austin is very particular about how we list those causes of death. And you can say multi-system failure, multi-system organ failure, or something like that, and then the other subsequent infections may are contributing to or contributed by, and COVID is listed. And so or we have to physically put COVID. It's not a checkbox. It's physically listed on there, or we have to physically list it on there. So that's how we report those. If we get, and also the health department, if we get word that somebody in the hospital passed away and it was COVID, that's how we report that as well.
All right. Thank you. This next question comes from a viewer. She's distraught because she hasn't seen her mother in a nursing home since mid-March, waving through the window. So the question is, are there any plans to loosen the restrictions on nursing homes that we can see our loved ones with the necessary precautions?
Yeah, Karen, that's a great question. It's a common question that I get. I get about one or two of those a day. Remember that those orders today, even though we've supplemented those orders, that order is from the governor's office. We still feel like the very best course of action is the one that's in place today. We, after having a number of deaths in nursing homes in March and April, we were able to really improve that situation by tightening down the traffic in and out of nursing homes. We've had a little bit of it pop back in the last month, but those patients are those the folks that live there, our parents, our grandparents they're so vulnerable that we feel like this is the best place to be right now. It's certainly where the governor is, and not a week goes by that Ron and I don't talk about this. Judge Parrish joins Dr. Cook and me for these conversations. As we've talked about before, he's got a couple of family members that are in our in senior facilities in Lubbock. Ron, do you want to add on to that?
Yeah, thank you, Karen. It's a very, very difficult situation. As I've said before, we put our loved ones in that scenario, in those environments, because either I myself and my family can't take care of them, or they need care beyond what I can provide at home. And so we put them there for a safe environment, because at home is not safe. I literally think about this every day. I've all the time trying to come up with different ideas on how to isolate and separate, where families could do it and go visit loved ones in an environment, but I've got to be able to create an environment that everybody who has a loved one in that scenario could do. Not just one individual, but every resident of a nursing home or long-term care facility. What we apply to one scenario must be applicable to everybody in that facility. And I've asked my geriatric colleagues what they've seen. I've asked them to scour the internet and look at other individuals, and I don't see anything coming up that we can use that's applicable to everybody in the facility. And it is very, very difficult. And as Mayor Pope said, it's a governor's order right now.
All right, thank you.
Thanks, Karen.
You're on mute again, Lacey.
I need to stop doing that. Now we have Brady King with Fox 34.
Good morning, everyone. Since the governor's order limits gathering size, we were curious if the police department or other departments from the city will be watching for parties as college students return to Lubbock.
Yes. Yeah. I mean, we think house parties are a going to be a challenge, and we generally we're not out driving streets looking for those, but we do expect that we would get phone calls to LPD, and we'll respond to those.
Okay, thank you. And for Dr. Cook, with the school year starting up, how difficult will it be to separate true COVID symptoms in younger kids compared to the usual stuff they see just being around each other, like runny nose, coughs, especially as we get later into the fall and winter?
It's going to be very difficult, Brady. That's a great question. And we worry about flu coming, flu doesn't take very long to hit. We should probably see those cases in the East Coast and West Coast. And there's a flu map that you can look up online. And so as we see those coming, we know that it's coming, and it does concern us. Unfortunately, we treat those symptomatically whether it's COVID or whether it's the flu or whether it's just the common cold or allergies or whatever. So the important thing to take away here is to make sure you go get your flu vaccine. And flu vaccines do not give you the flu. It cannot give you the flu. And so get your flu vaccine, and then we can say, well, you got your flu vaccine. It's most likely not related to flu. It may be COVID. So that's how we would sort of work through our differential on trying to determine which disease or virus that you have. And remember, viruses run around all year round, all the time, and more so in the winter. So.
Okay, thank you.
You bet.
Thank you, Brady. Now we have Olga Aguero with El Editor.
Buenas tardes. Hello, everybody. And let's all take the advice of the doctor and have our chocolate, the little bite, like he says, the little bite.
Poquito.
Poquito, exactamente. Okay, schools represent the community when we're talking about COVID-19. With this being said, how can you relate this to Lubbock with the numbers that we do have?
Yeah, it's a good question, Olga, and Ola, and buenas tardes to you too. I was thinking about it this morning in preparation for this call. If you let's just for a minute take Lubbock ISD, Friendship, and Cooper. They have north of 40,000 students, so ages 5 to 18, 6 to 18, something like that. We just looked at the number a minute ago. Since March, we've had 450 something cases in that. So, 1 in 10 would be 4,000. So we're about 1% of those that have been those students that have been tested positive for COVID. I think we make a lot of decisions in life where the downside is much greater than 1%. That's one way of maybe put it in perspective. I would just remind you, and you know this, but just to remind our listeners and your readers that it's a personal decision. The parent gets to make the decision. And I think that's very important. That is about whether they send the kid back to school or not.
Okay, and just to put a little bit of light into our kids, wishing them the best to go into school, and especially those little ones that are so interested and so full of adventures. And I just hope that we put it out there ahead of time before it maybe happens. And it's about, admiring your mask. And the little kid likes the other person's mask, and they trade masks. And then the little kid ends up going home without their mask, but with somebody else's mask. How will this be treated?
Just encourage them not to do that, but that's hard.
So don't do it.
Yeah, don't do it. Don't do it.
If you do it, do you go and tell your teacher the next day and maybe take it clean or something, or
I'm not gonna. I don't know how to do that, Olga. It's it's gonna be tough.
All right. Well, don't say I didn't throw it out there, okay?
I'm stockpiling on masks. I have 2 little ones going to school, so we have lots of extras. I plan to lose them.
Olga, thanks for all you do.
Thank you, sir.
Thank you, Olga. Now we have Grace Morris with KLBK.
Hi, everyone. So, Texas Tech is coming back, at the end of this month, and they have their own COVID dashboard sort of to keep track of students and faculty that's going to be testing positive. So when a Texas Tech student tests positive, does that count towards the number of Lubbock cases as well?
Yes, it will. Texas Tech will be assisting us with some of the contact tracing and the investigations among their community, but that's all being done under the health department, and all of that data gets reported back to us.
So do you, I guess, expect those numbers to, as students start to come back, to climb, and what's sort of going to be the process for addressing that?
Yes, I mean, we're on the, as we have more people in this community and more people are moving around and returning to school, we are going to see those cases. The importance is when someone's positive, that we keep them home and we provide support for them to stay home. And so that they're not out infecting others. It's all about slowing the progress of that virus throughout our community.
And it might be a little bit too early to ask this, but when a vaccine becomes available, sort of what kind of role do you expect the health department to play in giving that out to people?
We've had plans for years about large scale vaccination clinics. We've done that with other flu pandemics that we've seen. So the plan is, as soon as we can get those vaccines out, the most important thing is to get that into people's arms so that we can start building up that immunity. And we will be using partners such as Texas Tech, our fire department, anybody who's available to help provide shots safely to be out there making sure we get everybody vaccinated.
Thank you, guys.
Thank you, Grace. Now representing the Daily Toreador, we have Mateo Rosales.
Good afternoon. I have a question from a parent that reached out to us. Her question is that with the students coming back to campus and her son being a freshman on campus, the fear of having to quarantine inside the dorms is very prevalent on her mind. She was wondering, is there any types of resources or supplies that she needs to send with her freshman while he quarantines in the dorm, if that ever happens, or are there any things that they can do that they can send with him onto Tech campus?
Let me start, and then I'll let Dr. Cook finish. He's a lot closer to this than I am. Texas Tech's done a fabulous job on their website of playing through many of these scenarios, including a FAQ that gets updated very regularly. The first thing we want to send people to is that information, which is very detailed. If you have a question about fraternity or sorority recruitment, it's there. If you have it's just, they've done a really nice job. So Ron, you probably know more details. Why don't you fill in some blanks?
Certainly, Mateo, there is a dashboard and a website on the front page of the main page for Texas Tech University, and that can give you lots of information. I would certainly refer the parent to that website. As far as I know, that they do have plans for how to isolate an individual or quarantine an individual or his or her roommate, those sorts of things. They have lots of different options on campus, off campus. And so it's hard to say, because you have to treat each individual as an individual, that you can't do a blanket policies, but certainly being able to be independent, there's ways to get them food, there's ways to get them any support materials that they may need. Some of these people are they may not be sick, they may be exposed. And so then they will have to do distance learning. And I know that Texas Tech is set up for their virtual learning or distance learning from a dorm room or from an apartment or wherever in a house, wherever they live. And so they have worked through several scenarios.
Okay, thank you so much.
You bet.
Okay, and now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. This morning, I reviewed the cases by age group as the mayor mentioned a little bit earlier. He was talking about the numbers. The numbers that I read that are reflected on the dashboard demonstrate that 185 cases between 0 and 9, and then 622 cases between the ages of 10 through 19, which total 807. And clearly demonstrate that children, especially school-age children, are contracting COVID-19 in this area. And so I'm not sure the numbers that you have, Mayor, but although children are less likely than adults to show the symptoms, the proof that the number of children who set off the chain of transmission within their households continues to be underestimated. That being said, since you have a few school superintendents participating on the alert committee, What are they reporting as far as students who have chosen to do virtual learning and those who have already registered to go to class?
I think the last time I talked to the superintendents, they were close to 7 out of 10 parents were sending their kids back to school. Catherine, do you have any new numbers on that?
I've seen the same number.
Are you talking about the survey, 7 out of 10, or are you talking about when they reported that about 2,300 children in LISD had still not registered? Which number are you referring to?
I don't know, Christy. I'm just talking about anecdotally what they shared with me. I don't, that's their business, not mine.
Okay. Well, let me go ahead and go on to the next question, because can you remember when you closed the city of Lubbock, at what number were we experiencing cases that caused you to go ahead and close the city? Wasn't that like 30 cases a day in that area? We're talking about late, the third week of March, late third, fourth week of March. Certainly we were concerned about spread in the community at that point, and particularly we had some issues and we had some hot spots. I can't remember the exact number. Well, the reason that I bring that up, we have several folks that they feel that, you know, at times you guys are downplaying this number that we're dealing with, and that's what causes people to put their guard down, or in this case, their mask down, so they don't take it as seriously. Because, I mean, for example, we had 99 cases yesterday, and we're now up to 79 deaths. So the public is a little bit concerned. And 2 points that I want to make that you guys both spoke. For example, Mayor, you said just earlier that older community, the people in nursing homes are so vulnerable. And then Dr. Cook, you said that, you know, our loved ones, that at home, it's not always safe, and you have to isolate and separate and create an environment. But here's the issue that is of concern. We have families that have multi-generations at home. Hispanic families, for example, you will see more families that take care of the elderly. And so the concern is that, you know, we all want our children to go back, and I think probably some parents more than others, but there's still some concern as far as getting them back home after a day at school and not being really conscious. And their fear is that those numbers are going to drive up. And so if you have any thoughts on that, or any comments or not.
Well, I think it's a good point. We're in no way are we encouraging people to take their guard down. We know much more about COVID-19 today than we did in March.
Mm-hmm.
Our hospitals are much more prepared. We have much more testing. We understand much more about the spread. But in no way are we diminishing the or talking down the significance of this. And you heard me earlier talk about how education, one of the challenges is kids that live in homes where there are vulnerable population, whether they be parents or grandparents or aunts or uncles or siblings. I think I'm pleased that there is an option for them to learn online, and that would be my response. And
Can I just ask, because I think this is important, and you know, I make it a point to get my flu shot. Dr. Cook or Catherine, when should people start getting that flu shot? Is that in September? And will you be doing any clinics like you always do at the health department?
Yes and yes. We all need to get our flu shot as soon as that vaccine becomes available. We will be doing flu shot clinics. We're actually having a meeting this afternoon about what that will look like. They will probably be out in the community versus actually at the health department, because so many people are here or dedicated to those COVID investigations. We have also secured additional vaccine this year through the Adult Safety Net program, which is free vaccine that is for people without insurance, that the health department will be able to give without any charge. And we'll be pushing that out as soon as it comes into stock.
Thank you.
Thanks, Christy.
Thank you, Christy. And lastly, we have Gabriel Monti with the Avalanche Journal.
Good afternoon, everybody. I just had a question. I was wondering if y'all could kind of clarify or give a detail of what the plans the schools have, once they open to sort of slow down the spread or protect children going to school in person from being infected.
Gabriel, I think probably those plans that question's best posed to the superintendents. I mean, we've been involved in the development of those plans, particularly Dr. Cook and Ms. Wells, but I don't think we could speak to the specifics of those.
Okay, that's pretty much all the questions I had.
Okay, thank you.
Thank you, Gabriel. Thank you to our media for asking questions. Thank you to our interpreters and our panelists, and thank you for joining us. In the meantime, if you want more information on COVID in the community, go to mylubbock.us/COVID-19, and we'll see you next week.